Hello, my name is Dr. Jeffrey Yu, and I'm a board-certified physician in both internal medicine and gastroenterology, practicing in eastern North Carolina, where we're seeing firsthand the devastating effects of the MASLD and MASH epidemic, what many of us know as fatty liver disease. I'm also joined in this effort by Dr. Ray Dong, a fellow board-certified internist and gastroenterologist based in New York City. Together, across both urban and rural populations, we've integrated iLivTouch into our practices to identify liver fibrosis earlier, more easily, and more affordably, and it's made a tremendous difference for our patients.
Unfortunately, significant fibrosis often exists in patients with no symptoms, and without a way to assess liver health directly in the clinic, these patients may remain undiagnosed until it's too late. As we confront a nationwide epidemic of MASLD and MASH, especially in communities like ours in North Carolina and New York, accessible, non-invasive liver fibrosis testing has become a cornerstone of modern liver care. Here are the patients we screen regularly: type 2 diabetes, obesity and metabolic syndrome, elevated liver enzymes, ALT, AST, without clear explanation, fatty liver on ultrasound or imaging, hypertension, high cholesterol. In both North Carolina and New York, we've identified an alarming number of patients with F2 and F3 fibrosis, patients now eligible for treatment they would have otherwise never known they needed. One of the key challenges in liver fibrosis care is access. Traditional liver elastography devices can be prohibitively expensive, limiting their use to large hospital systems. But iLivTouch offers a solution that is significantly more affordable, allowing private practices, GI clinics, and even primary care offices to offer this essential service without massive upfront costs. For patients and physicians alike, this means more access to fibrosis testing, closer to home, and fewer barriers to getting the data needed for Resdifra eligibility and other interventions. One of the biggest reasons we chose iLivTouch over other options on the market is because it was clearly designed for real-world clinical use, not just for research centers or hospitals, but for busy community practices like mine and Dr. Dong's. First, iLivTouch uses a single universal probe, which is a huge advantage. Whether you're scanning a slim patient or someone with obesity, there's no need to switch out probes or worry about ordering separate attachments. This saves time, reduces complexity for staff, and eliminates the costs associated with managing multiple probe types, something that's been a major pain point with other systems. Second, iLivTouch is fully portable and lightweight, so we can bring the test to the patient, instead of having to move patients around the clinic or send them to a hospital-based device. This is especially important when you're managing multiple locations or when working with patients who have mobility issues. In fact, our team routinely moves iLivTouch between different offices and locations. It's compact, fits in a small footprint, and sets up in minutes. Third, the scan itself takes less than 10 minutes, often even faster, with only minimal preparation required, typically a 2 to 3 hour fasting period. Because of how quickly and efficiently iLivTouch operates, we're able to integrate liver fibrosis testing into the patient's regular visit, often during the same appointment, with very little disruption to clinic flow. Another key feature that makes iLivTouch stand out is its built-in Wi-Fi and network connectivity. Once a scan is completed, the results are automatically saved and securely transmitted to our network, allowing for easy upload into the electronic medical record system. This means physicians can review, co-sign, and bill directly from the EMR, without any extra steps or manual data entry. It's a seamless process that saves time, reduces errors, and ensures every scan is properly documented and billed, an essential advantage for busy practices focused on both patient care and operational efficiency. The reports generated by iLivTouch are designed for real-life clinical use and fully customizable. They're clear, intuitive, and include diagnostic staging guidance, so whether you're a gastroenterologist or a primary care physician, you can act on the results with confidence. Customizable cutoff values for liver stiffness and UAP to match your preferred guidelines or evolving clinical evidence. Add your clinic's logo and adjust report formats to align with your workflow and branding. Makes communicating results to patients easier. Huge advantage is that medical assistants, not physicians, perform the scans, and they do so quickly and effectively after just a short training period. This means physicians don't need to spend time conducting the scan. We simply review, co-sign, and move forward with patient care. Our MAs can easily perform 3 to 4 scans per hour, making this a highly efficient process that adds real clinical value without adding time to the physician's day. In short, iLivTouch removes nearly every barrier that's kept liver fibrosis testing out of reach for many practices, whether that's cost, complexity, workflow disruption, or staff limitations. And that's why we believe iLivTouch is the right solution at the right time.
If you're interested in learning more about how iLivTouch is helping practices like ours identify patients with F2 and F3 fibrosis, or how expanding access to liver elastography can support broader treatment goals, including the use of Restifra, we'd love to start that conversation. Thank you for all that you're doing to bring new treatment options to patients, and we look forward to being a part of that solution together.